Hello y'all, thank you for tuning in to another one of my videos. For those who don't know me, I'm Lexi. I am a previous nursing student, now a registered nurse. If you're new here, hello. If you're not, welcome back. Please go ahead and like and subscribe to my channel. That'll help me so much. And today we are just going to talk about how I passed my NCLEX on the first try in 85 questions. So if you are interested in knowing that and what kind of tools that I use, please stay tuned. So on the day of my NCLEX, I arrived early. I didn't do anything the night before. No, I take that back. So the day before my NCLEX, they say not to study, but that morning I went over some notes that I had. I cut that off probably about 12, and then I relaxed the rest of the day. The day of my NCLEX, I arrived to the testing site maybe an hour or hour and a half early. I can't quite recall, but I know I was pretty early. There's a video that I have that I put up for the day of my NCLEX and the experience that I had. So I first want to say that I did not spend an enormous amount of time studying for the NCLEX. I feel that the program that I was in basically set us up to pass the NCLEX, that's what nursing school is about. It's for them to prepare you to pass the NCLEX. So I felt like I had a pretty good foundation in preparation to take the NCLEX. So I spent 2 weeks really studying for the NCLEX, like consistently. I would study for probably like 2 or 3 days, take a day off, 2 or 3 days, take another day off, up until it was time for me to take my NCLEX. So the materials that I used the Uworld. A lot of people that take the NCLEX or prepare to take the NCLEX use Uworld. There's like Uworld, Archer, Hearst, a whole bunch of different programs to help you prep for the NCLEX. So I used Uworld. It came with about a little over 2,000 questions. I only used a fraction of that, probably like a fourth of it. Just answering questions and doing self-assessments and doing like practice CAT exams. All my practice CAT exams that I took, they shut off at 85 with a high or very high chance of passing. I probably took like 2 or 3 of those. I also did I did the 2 assessments that Uworld provides you with. I had the month subscription, so that came with 2 self-assessments, and I both scored high or very high chance of passing. And on my CAT exams, they always put me at a difficult level for questions, like the difficulty, they had it high. So I guess that means that I was answering the questions properly. Other than Uworld, I used Mark Clemic lectures. I listened to all the lectures 1 through 12 for one time, like one cycle. And then along with that, I went along with his notes from I can't remember if it was the blue or the yellow book or just the lecture notes. So I had notes, and I'll try to, any resources that I have, I'll try to put it down in the description. So listen to Mark Clemic. After I will listen to a lecture, I will review that lecture, the notes for that lecture. So I will listen to it, take a break, maybe the next day, because his lectures were like anywhere from 45 minutes to maybe an hour and a half long. And I will try to see, give my mind a break, try to see if I forget something and go over the notes later on to kind of refresh, and then I will move on to the next lecture. So I did that. I continued to do questions on Uworld, and when it came to the day before my exam that morning, I just read through the notes, through the Mark Clemic notes, and that was pretty much it. I watched some YouTube videos here and there on other YouTubers that took the NCLEX and the tips that they recommended as far as like pharmacology and delegation, things like that. Watching videos here and there. But other than that, that was all that I did. The main resources, Mark Clemic and Uworld, that was it. And it's just really, like they say, it really is a safety exam. I think it has more to do with knowing how to answer the questions and recognizing what it is that they're asking you. Like, are they asking me prioritization or delegation? Things like that, and knowing how to answer that question, knowing how to answer questions that ask you what is the best thing to do versus what is the first thing to do. And I feel like Mark Clemic really did a good job on explaining that to me. So that helped. And that's not to say to not study your content, because it is important to know content, especially when it comes to the next generation NCLEX questions, like the bow ties and all those case scenarios that they give you. Content is very important. But as I stated, I feel like my program set me up very well to pass the NCLEX. And I did fairly well in school. Majority of my classes, I made A's. The other classes, I made B's. And it wasn't like low B's. It was like anything over a 90 and above was an A, and my B's were like 88, 89, stuff like that. So I did fairly well in my program. But it took me, I took my time answering my questions. I was very anxious throughout it all. And there were things on there that I felt like I never heard of, or maybe I have, and I forgot it. So knowing your content is important. Doing well in school is important, because nursing school, it might not teach you how to be a nurse on the floor. That's what your clinical experience is for, so that you could get a glimpse and a little bit of experience of how it is being an actual nurse at work. But nursing school prepares you to pass the NCLEX. Resources that I used throughout nursing school, textbooks that they provided us with, not that they provided because we have to pay, but textbooks that came with the classes, those I did not too much read. All them textbooks and all the chapters. I want to say, like, in the beginning of the program, when it came to foundation and assessments, I was more going towards the textbook to make sure that I knew the order of certain things to do during procedures and sterile fields, and knowing the difference between a different type of moles and skin markings and things like that. The very foundational stuff. And knowing how to properly do a head-to-toe assessment, stuff like that. Yes, I went to the book to do. But all those other classes, I studied on the lectures that they gave us. They always provided us with notes. Some classes provided us with stuff like worksheets to fill out while we listened to lecture notes and stuff like that. And so that's what I did. I studied really hard during nursing school. At some point, I realized that I did have to put my social life aside in order to do good in nursing school. Another thing that I used during nursing school was the RN Explained, the Nursing School Comprehensive Bundle. I purchased this on Etsy. You can find this on Etsy, as well as this is Nurse Stephanie. So she's on social media, on YouTube and on TikTok, Instagram, and stuff like that. And she does a really good job of helping you to answer questions and explaining things to you. So I purchased this with my own dollars. This is not a paid review. I purchased this with my own dollars on Etsy, and I sectioned it and organized it in a binder. And when it was something that I needed to understand, like a topic that I needed to understand more easily, I will refer to her nursing school bundle, and it did help. She has mnemonics in here that are very beneficial and help you remember help you to remember certain information. Other than that, I would look up YouTube videos on certain topics that was hard for me to grasp. I also spoke to classmates within my clinical group, helping them, asking them, hey, I'm having a hard time understanding this. How do you remember it? What maybe mnemonics or what things do you use to remember this and that? I was also gifted the complete nursing school bundle from NURSEINTHEMAKING. I believe that she is also here on YouTube, and her stuff is very beneficial as well. Although I did not really use this bundle this much. I mainly refer to Nurse Steph's bundle, but anything is beneficial than having all them textbooks. I also had this book, the NCLEX-RN examination. This is edition 8. Didn't really use it. I wanted it. I used it a very little bit, maybe a couple of pages through MedSurg section, but I didn't really use it. I didn't use it to study for the NCLEX. But the app, I answered some questions on their app. So when I would be on like vacation, or it would be like a school break, which was rare, few, because I was in the accelerated program. But when I was on break and when I had like nothing to do, I would go on the app and answer a couple of questions. And other than that, that helped me prepare to have a proper foundation to take the NCLEX, because I feel like it is so important before when you're choosing your university or community college or whichever one that you want to go to, it is so important to look at their passing rate for NCLEX, because I feel like there are schools out there that they will be on the verge of losing their accreditation because their passing rate is so low, and they keep it on a hush because of course they want that money. They want the, FAFSA and all those other student tuitions and all the other stuff that come along with nursing school. They want the money. So they'll keep that on a hush, and before you know it, the school be closing down in the middle of a semester. So it is so important to research the school that you want to go to, look at their passing rate, also look in their ratings to see if they're a good school or not. I knew that I wanted to go to my university because I had known previous co-workers that did the program at this university and passed. They passed their NCLEX on the first try. I wasn't for sure how many questions they had, but everybody so far in my clinical group, and it is a total of 7 of us, passed their NCLEX on the first try, 85 questions. So that just goes to show you that the curriculum, it may be rigorous, but there's a method to the madness. Like 85 questions and that was it. And I was so relieved. But other than that, those are the tools that I use to pass the NCLEX. I made sure that I was within a good school that was going to teach me what it was that I needed to know in order to succeed. I don't try to find the easy route in things because that usually bites you in the behind. So like if there was extra sciences that I had to take, then so be it. But I knew that that school was going to help me get to where I wanted to go and get me there quick in one trip. So that is the tools that I use to pass my NCLEX. And so in my last video, after I took my NCLEX and got my results, I said that I would share with y'all which department I have accepted a job to as a new grad. So the department that I will be working for is oncology, hematology oncology. I'm excited. I did get to attend a new nurse residency mixer where I met some of the other nurse residents that will be in the program with me. I also got to do a tour of the floor that I'll be working on, so I'm a previous employee of the hospital that I will be working at. Again, I was a medical assistant there. And so I was partnered, when I applied for school, I was partnered with them because I worked there. So I was able to complete majority of my clinicals there. So I already know what everything looks like. All the floors look the same. It's the same template, the same architectural template or whatever, foundation, however you want to say it. So all the floors look the same. I had never been on that floor for clinical rotation, so it was good to just go. And I also got to see some of the day shift nurses. I will be on night shift because I'm a night owl. Like, it's 11:15 at night right now. So I'm a night owl. I stay up all night and I enjoy night shift. So I chose night shift. My first day of work will be this coming Monday, the 29th. It's my first day of orientation. So yeah, I got to tour the floor and meet some of the people, the day shift staff. I also got to meet a clinical coach and some of the preceptors. Yeah, I am excited. My nurse residency program is a year, but for the first 3 months, we'll have like didactic classes twice a week, Mondays and Tuesdays. So that's pretty good. There is a presentation project that we have to do in April. So that's what, January, February, March, April, like the third month. Once the didactic classes are done with. And I think they just follow us. You just get with your preceptor every now and again and your educator to see how things are going and how you're progressing as a new nurse on the floor. So I'm excited about that. The reason why I wanted to do a nurse residency program is because, for one, I knew what hospital I wanted to work at. I wanted to go right back where I came from. And for two, I feel like it's a good transition in getting you in a groove of being a new nurse. Because when it comes to, you know, clinical rotation, where towards your capstone, you're taking on, you know, one patient per shift, and then going to like 4 or 5 patients per shift, that's hard. And I know everybody has like an orientation period, but in order for me to do the best that I could do, I want to make sure that I have the resources and the help that I need to succeed. I don't want to be making mistakes. I've made mistakes, and I made sure that I didn't make sure that I made them, but I made mistakes, and thank God they were during nursing school and not, you know, on the account of my license. So with that being said, I am so excited to be a hematology oncology nurse. I thought I wanted to go to the ER and be a nurse, but I did my capstone in the ER and I got over that real quick. I like the fast pace. I don't have a problem with the fast pace, but I don't like the culture of the ER at this specific hospital that I'll be working at. Somebody else might like it. It's just not my thing. I don't feel like, I don't know. I'm a happy-go-lucky person. I'm optimistic, positive. You know, I like to smile, laugh. I know that's not always the case in the hospital when you're working. You have your good days, you have your bad days. But I don't know. It's just a little bit bitter down there. So even though I might have wanted it, God put me elsewhere, and I'm thankful that he did that. So I've gotten a good vibe from the tour that I did on the unit that I'll be working on. So I'm pretty happy about that. I'm excited, and I'm just ready. So other than that, if y'all have any questions about any of the resources that I used, please comment down below. I will be answering any questions that y'all have. And please, please, please don't forget to subscribe. You know, I'm new to YouTube. Of course, everything is mediocre over here. I have yet to advance, but I promise that I'm working on it. So if you have any questions, comment down below. I would try to post the resources that I use down below. Hopefully I could put a link on how you could get to it. If y'all did not see my NCLEX day, exam day video, I would try to put it flag somewhere up at the top so that y'all could click on that video and just see, kind of get a idea of what to expect on a day that you go take your NCLEX. But yeah, 2 weeks of studying, 2 main resources, 85 questions, first try, passed, and that's it. Y'all have a good night.